Today's webinar we'll be talking about Taiwan's fight against COVID, their nursing experience. My name is Dr. Nancy Ngumbao, and I will be moderating the session for today together with Dr. Rhoda Kalondo. Today we're proud to have visitors from NCKUH Taiwan, who will be giving us this talk of the nursing experience. Nurses form a key part in our healthcare system. They're the actual front runners in terms of nursing these all the COVID patients, and they have the most interactions with these patients. So we're really, really privileged to listen to today's nursing experiences. And for all our attendees, we are awarding CPD points for every cadre. Kindly email us your CPD inquiries at knhcpd@gmail.com if you have any queries. So right now I'd like to give the team from NCKUH Taiwan to introduce themselves, and then they can proceed with their session. Thank you. A team from NCKUH, you might be on mute. Kindly unmute yourselves.
Hi. Hello. 跟你那个视讯画面没开，电脑打开。Jumbo. Hello everyone. Can you hear me? 要转那个啦，视讯要转那个 BC 护理。
Hi. We can't hear you well. Kindly increase the volume of your device so that we can hear you.
Okay, so can you hear me?
You're still not very, very clear.
One minute. Let me check.
他没有都可以选哦。
那我就是学校那边吗？
现在吃不到那个。对啊。
Hello. Hi everyone. Can you hear me?
We can hear you, but the volume is still low.
Oh, volume is really low.
声音对啊，现在声音太小声了。
Is it louder? Is it okay?
Yes, if you can be a bit louder, that would really help. We can hear you, but with a bit of difficulty.
Okay. Wait a second.
Yeah.
Hello. Can you hear me? Jumbo?
Jumbo, we can hear you. And,
so the voice is clear now?
yes.
Excellent. Yeah.
Yeah.
So should we start or?
Yes, we can start. You can introduce yourself, Professor, and you can start the session.
Okay. So let's turn on my PowerPoint. Yeah. So can you see my presentation point? Power? Oh. Hello, can you see?
Yes, we can see your presentation.
Okay, good. Yeah, Jumbo, everyone. Yeah, this is Monica, and it's my great honor to be invited to share with you about the lesson learned from Taiwan, how nurses fighting against COVID-19. And I am Professor Cole, or you can call me Monica, and I am ICN International Council of Nursing certified trainer and HIV/AIDS expert. And I also have participated in several panels in important international meetings such as UNA, UNCSW, and WHA. And right now, because of my specialty focus on emerging infectious disease, so since 1990s, early 1990s, I am a pioneer of people of taking professional taking care of patients with HIV. Since then, I have been combat such as SARS and MERS-CoV and Zika virus, and also including this COVID-19 pandemic. So before we start, I want to share with you this film.
I can imagine. Hey, you're here. You've done very well. Yeah, right.
Going on. Like Jenny Murphy as a patient is done. And I shall go out there to make testimony that I was just going to put you to just please talk about me, for the other guest. I walked in here, I should look up. I'm feeling quite elated. Very much so. Very much so. I want you to understand that I am truly grateful from the bottom of my heart. I've worked with NHS since 1970. I've done everything in my life, never taken off sick, so you can imagine how angry I am at this stupid illness. I want you to all know that I am truly grateful. I indebted to a lot of you who left their families so far away, and you are here to help us. Please, just hold on a little bit more. We shall overcome this. And when we do, the NHS hopefully will be better for it. So I am truly grateful. I am proud to be a nurse. Thank you.
This is a very touching film. Shows that as a nurse, as a frontline healthcare worker, and we sacrifice and we face patient, and sometimes you become a patient. So according to International Council of Nursing, right now more than I believe more than 1,000 or even more nurses around the world have died from COVID-19. Yeah, so as a frontline healthcare worker, I think nurse is the major workforce. So we taking care of patients, and that's why today I want to share with you from perspective of nursing to see how do we combat with COVID-19. So in Taiwan, right now, only 4 nurses infected with COVID-19, and 0 of them die of this disease. So that is very important to see. Right now, all over the world, more than 1 to 1.2 million of people has been diagnosed with COVID-19. And Kenya is around 10,000 cases. So you will see in the bubble, the monitor, you will see if the bubble is bigger, means the case number is large. So compared to Taiwan, we only have only few cases. Yeah, right now we have 451 cases was diagnosed with COVID-19, including 7 deaths. And we go back to see the slide. Yeah, and we find in Taiwan. Yeah, as I mentioned, right now is a 451 positive case because yesterday we we only have 2 more cases. Yeah, so why Taiwan is so successful and how we call it Taiwan model, I want to show with you a film.
We have seen countless acts of bravery and sacrifice from medical workers around the world. It is our duty as global citizens to give them our full support. Pandemics cannot be stopped by one country alone, and Taiwan stands ready to do our part.
Taiwan model. So how Taiwan is so successful, right now, all of us has go to school. No one left behind. And no school has been closed during COVID-19. And everybody have go to work. And most of them just present in office. We don't work from home. No city was locked down. So how Taiwan model is so successful because we have following successful factor, such as because we do have experience of SARS experience. I remember in 2003, I has been working in hospital to help people and patients with SARS. During that moment, I cannot forget many of my colleagues, their children cannot go to kindergarten, cannot go to primary school. Why? Because their parents working in hospital. And many of my colleagues suffer from infected with SARS, and some of them die of SARS. But after experience, we know how important to protect first line healthcare workers, because without their help, we cannot survive. And the second key success factor is the information transparency. So we have a center, epidemic command center. So we can see information transparency. Yeah, so you will see that we have a command center. So every day, just like a newspaper, they report to the epidemic situation to the public. And yeah, so you will see like the commander, he is the Minister of Health and Welfare, and he hosts a COVID-19 press conference every day and report the situation and answer any question from the journalists, and to clarify some misinformation, to clarify some fake news, and also to deliver important information. And we do have different social media to tell all of us about how do you have any question and how can I come back from other country, and if I know something or someone has a suspected case, how do I do, and where I can go for hospital if I travel back to Taiwan. Yeah, so those information are very important. And the other factor about the advanced medical technology. And in Taiwan, we have many advanced medical technology, such as rapid test, and then later on, I will introduce my innovation technology to all of you to see how do we provide such important technology with us. So including rapid test and keys, we're working with different manufacturers and other scholars. And we also deliver and send our innovation to other countries. So that is very important to that. And the other is like smart community transmission prevention. Yeah, that is we apply modern technology to do surveillance and also do a quarantine. So you will see this figure. Yeah, you will see we using a quarantine system for in airport. So each each customer or each citizen around Taiwan, they have to fill in online reporting for entry, and those of systems are automatically integrated to home caring and home quarantine system. So the government or the people who working in Bureau of Public Health Agency, they can call them and make sure they're really at home for quarantine. If they are out of home or without notice or within 14 days, and then they will immediately notify to police officer. So they will call them and make sure they really have see that. Okay. Yeah. So the smart community transmission prevention is very successful. So that's why our cases are limited, because we apply technology and then also to make connection with police officer and also neighborhood, and then we can work together to reduce the possible local or community infected case. And our successful experience was delivered and shared with others. For example, like you will see, this is from ICN, and that is a global meeting also with WHO, and then Taiwan success model become a very good example to share with others how do we do it together. Yeah, so that is a newspaper and also a broadcast and online meeting with different nursing leaders. And in NCKU, because right now I'm a director of the Department of Nursing, NCKU National Super University. So we also share with nursing education our experience. How do we provide education during pandemic? So we share our experience using a webinar, and I had been invited into several international webinars to share with an international colleague about how to we fight with COVID-19, and also to share with them how to doing research. Yeah, because during crisis is also an opportunity. How do we do research during those COVID pandemic, and also to accumulate the knowledge and using the knowledge to fight against COVID-19. So the following I want to share with you about nursing in COVID-19 in Taiwan. I will show you three important aspects. The first is patient first, people first. How do we provide patient-centered care? And second is salute and the support for nursing profession, and how nursing leaders to show their positive energy and create positive image for nursing profession. And the last one I would like to share with you is my innovation, HeartSomo, that is a wearable device, and how do we apply the new technology in nursing care. So first, I would like to share with you patient first. Yeah, this is our isolation room, and that is how we provide care. I believe it's similar like you did in Kenya. And you will see that is a pair of parents look at their daughter, and their daughter was isolated in our infectious ward for more than around almost 2 months, and they miss their daughter so much. They want to say something to her, but they also want to meet with her. So we think about how do we do that. So we her daughter sit on the wheelchair, and then cover all of the PPE, and then they can just very close just over a window, and then they can touch and see in person, also talk and express their love. Yeah, and great. And every patient, if they be isolated, walk away from isolation room, we will take picture with them together and show how many days they stay in isolation room, and also to provide and encourage them. And this is another patient. This is our first patient. And after she discharged from hospital, and we met with her, and she said she wants to go back to the room. She has stayed for almost 1 month, and she wants to look at the window again. And also she shared with her feeling and story with her with us. And right now we just write up a qualitative study to accumulate many stories from patients' perspective. And during COVID-19, I continue write. This is a newspaper, and actually you will see that there's a series of stories I have wrote to recall and memorize the old memory we has been went through during COVID-19, and I believe we are going to publish a book now. So that is a very important. That is a very important part. Yeah, so as a nurse, as a professional, and also as a leader, I think every nurse's and patient's memory and experience will count. So how do we memorize that? That is very important. And I also create a website to update all information, also multi-language support. Yeah, because in Taiwan, we have many immigrant workers, and they do need to know the information about COVID-19. So I create a website to help them. And if they have any information, they can go to the website and to access the correct information and knowledge for COVID-19. Yeah. So I show you how do we provide care in our NCKUH hospital. How do we provide care?
是可以，可是再大声一点会比较好。
我是检疫站的工作非常的繁杂啦，但是我们有分成 A、B、A 区都负责病人如果进来的话做第一关的一个检疫，那我们 B 区的话就是协助医师人员的一个挂号，还有就是协助医师他们在看诊的部分的一些诊断流程。我们上班就是要诊中解肺，尤其是带着很久，然后一方面要跟病人询问病史，然后又要卫教，其实对我们来讲，身体的负担是大的，因为长时间的一个缺氧的一个状况，我们回去就整个就像枯萎的花朵一样。我在想，应该是社会民众对这个疫情还是不要太恐慌，就是对我们最大的帮忙。
大家好，我是白云慧，在台湾南部的医学中心的感染科病房工作。我们现在主要照顾的病人就是疑似的状况，然后他们上来的话，就是主要是要等他们筛检的结果，然后确定没有问题之后，我们才可以把病人转出。医护人员每个人都有家庭，所以你当然会担心，就是这个疾病会不会影响到你，然后甚至影响到你的家人。所以在我们的穿脱隔离衣上面，阿长他常常都会提醒我们说，你慢慢来，去脱除，好好的穿脱在你的隔离衣是最好保护自己跟家人的一个方式。那我们这边虽然不能探病，可是它可以带病人他需要的一些东西、一些物资进去给病人，这些都可以。然后电话我们也可以允许带过去。所以主要其实就是要让家属他放心，然后资讯是透明的，他就可以让他减轻一下他的焦虑。
非常有趣。目前在台湾的南部医学中心工作。其实我觉得我可以来就是所谓的第一线，我其实蛮兴奋的，因为我觉得我自己还是有点护理的使命感，还是会想要在第一线，然后帮助大家。如果有人担心不敢来这个病房的话，我觉得我自己来，我也觉得我可以做到这件事情。
我叫做谢云涵，是一位在台湾医学中心工作的副护理长。新冠肺炎初期，我参与了在一个急诊前面的空地搭建简易筛检帐篷。那这个简易筛检站呢，它其实是一个帐篷式的护理站，检伤分类区、留观区，还有储物区。其实在这个医疗照顾的背后，是有很多医护人员、很多护理师冒着生命危险以及付出他们的劳力，在第一线进行防护。所以我希望在这次的疫情过后，社会大众能够重新重视台湾护理师的重要性，让优秀的人才可以得到回报。请让我们继续照顾与守护国人的健康。
Yeah, so this is our nurses working in the front line, and we are so happy to see our screening station is temporarily closed. Yeah, I remember I entered into the COVID-19 war since January 20, and then during the whole process, we had closed the station on May 22nd. And that is very important, is to have a great nursing leaders, because as a great nursing leaders, you have to be negotiated with superintendent and to secure every nurses can have sufficient personal protection equipment. And also important is in Taiwan, every nurses, they have $10,000 for their compensation to take care of COVID-19. Yeah, and our chief nursing officer also go to the media to share the correct information and also to teach, to do the public education. And that is very important to show nurses' work in public. How nurse is brave and how nurse to help people. Like this nurse, she helped a child with hemophilia. So she flew to China to take care of the child and then bring back the child and the mother back to Taiwan. Yeah. So she says she is very proud, but she is doing just like everyday nurse do, because she take care of a child just like a sick child in hospital. And this is another story. She is a head nurse and she voluntarily to take care of COVID-19 patients. She became a role model. So she lived with her staff, step into the isolation room, and then also go to the airport to help our Taiwan citizens in other countries. And her effort was publicly recognized by our President Tsai. And also, there are many retired nurses staff. During the pandemic, they want to provide their help, their professional help. So they just go to a hotline, they organize a hotline station to call those people who are home quarantine or they have question, anxiety during COVID-19. Yeah, so you will see some of retired nurses workers were organized by Chief Nursing Officer, Professor Tsai. Yeah. So President Tsai openly acknowledged nursing workforce is the crucial team to fight for COVID-19 pandemic. So not compared to 2003 in SARS experience. Nurse like a role or a preparation sacrifice, but in COVID-19 pandemic, nurses become a hero. Nurses to show their positive image, and not only doctor take care of patient, nurses help a lot. So not only a President Tsai, our Minister of Health and Welfare also openly recognize nurses' efforts. So the second I would like to share with you how about we do research and how I apply my innovation device into first-line care. So because as I mentioned in the front, at the beginning, my specialty is emerging infectious disease. So the recent 5 years, I'm working on AIoT, artificial intelligence of things, to empower smart surveillance of public health. So we start from mosquito, for dengue fever, and this COVID-19, we're working on overall prevention. So this is the team I work with. So I coordinate all the team together from Department of Computer Science or Department of Mathematics, and also from Infectious Disease and the Nursing Department. We work as a team. And in 2018, we discovered a real-time monitoring individual physiology parameter we call heart thermal. This device is used to continually monitor temperature, heart rate, and also their activity. And during the recent 2 years, we identify and have confidence that heart thermal can early predict fever. So during every infectious disease have fever, have high temperature. But COVID-19 have the middle temperature. Yeah, so how do we know the pattern? So that become a very important idea and scientific question. And our device has been shown in 2019 commercial electronic show in Las Vegas. And during COVID-19, how do we apply that? We apply heart thermal in 3 populations. First population is patient in isolation room. And second population is to students in home quarantine. And then all the frontline healthcare workers also wear heart thermal. And during that time, we provide smart care combining cloud computing and artificial intelligence. So based on that, the heart thermal is identified, they have different, or we think that is a successful or high fever, and they will gather notice. And then they will double check the temperature And if they, before they go to work, they already find the temperature and heart rate is increasing, we can stop. And then we can ask them to ask for sick leave. Not let them go into the hospital until they really have problems. So that is our whole service to provide early detection and the warning and protection for our healthcare workers. So you will see how do we do that. So in our hospital,
Hi, Prof. We can't hear you.
So our study has been published in international peer-reviewed journal, and identified how important to continuous temperature monitor, especially during the COVID-19 pandemic, are so important because continuing monitor healthcare worker temperature can prevent from cluster in hospital and further to protect their health. So you will see all of our health workers will have thermal, and not only our health worker, also our patient. So the final, I want to say the lesson from nursing in Taiwan. How do we learn that during COVID-19? The important is salute, support, and success. 3S. As a frontline worker, we want all of them to be recognized. So to salute them and thank you for their effort. All of nurse and midwife and other health workers are at great risk of COVID-19. So that is their mission, but they also want to be safe. So support is very important because they work long hours, they feel fatigue, and sometimes they has been stigmatized or discriminated by their neighbor. So how nursing leaders or the leader in public health to openly support them, salute them are important. But our service always not good enough. They need substantial material to protect them. So sufficient masks, glove, that is the basic, because that is the basic weapon to fight with COVID. So we need them healthy, stay healthy, and then to protect us. The final is, I think nurses is important. Nurses and midwife is important because they care for all. So without investing in their health, to investment in their PPE, how could we survive? How could we successfully combating COVID-19? So I think the most important to support all of nurses and midwives, and Taiwan can help. Thank you for your listening.
Thank you very much, Professor, for your presentation. And I think we've learned a lot from your presentation and the nursing experiences, and I agree. The nurses form a huge team of the healthcare workers that are actually taking care of the patients who have been infected and affected with COVID-19. And I think you bring out the issues that most of the nurses want addressed. So support for health, for the nursing team and the PPEs that are there. And I'll take a question from one of the attendees. So they're asking, it's remarkable that only 4 nurses have actually been infected and 0 of them have succumbed. So what sort of PPE do you use? What levels of PPE? Do you just, is it uniform for everyone that you wear the hazmat suit? When do you use an N95? When do you use a surgical mask?
Okay, yeah, in Taiwan, because I mentioned we have been went through the SARS experience. So in Taiwan, all the healthcare workers need to wear a surgical mask during take care of patient. And for the COVID-19 pandemic, yes, I remember since January 20, and we start to do some outbreak drill. So we exercise how do we provide care for patients suspected with COVID-19. We wear full personal protection equipment. We exercise how to take it on and take it off. Not only nurses, but also doctors, and then we practice again and again. Yeah, and I remember the first day, we start to make sure the stock is full, is sufficient to provide all frontline nurses and doctors can have their own PPE. Yeah, so I think that is very important for the superintendent. We talk with her, we talk with him, and also our director of nursing department. And then they simply the basic, that is the basic support. So we secure the PPE all sufficient for all healthcare workers. I think that is a key issue we can combat against COVID-19 in Taiwan.
Thank you very much, Professor. And I think one of the things that I am coming to learn with COVID-19 is all healthcare workers are very important in this fight. And there's one thing that you presented in terms of innovation, that it's actually come from the nurses in Taiwan. And I think that's a very, very good thing that maybe us in Kenya and the nurses who are here on the attending the webinars should actually take up in terms of innovation. So I'd like to ask the question for home-based care. Is that happening currently in Taiwan for patients who are confirmed? And if so, how is it happening? And then for suspected cases also, how are you managing them in Taiwan?
Can you say that again? You mean the healthcare workers infected with COVID-19 or?
I mean the patients. So is there, because in Kenya, we've started the home-based care for patients confirmed to have COVID-19. Is that something that's happening in Taiwan, and how is it happening? Then also for suspects, how are you handling them?
Yeah, in Taiwan, if a patient was home quarantine or isolated quarantine, yeah, and then they will stay at home. And all the healthcare, the public health nurse, they call them twice or 3 times a day to make sure their health status. If they have some symptoms, they will call 1922. Yeah, that is a hotline. And then Taiwan CDC will send an ambulance to take them back to hospital. And then we will connect together. So if they have any symptom, we will just quickly to management. And if they have a fever, we will double check and then we will send them to hospital. Yeah, very quickly. And the other is, yeah, in the rural area, really, we do have home care visit nurse, basic in their village. But if they have some question, we also provide direct care. But any suspect symptom, they will direct contact Taiwan CDC and send them to hospital right away.
Thank you very much for the answers. I think I'll give a minute or so to Katama, one of our nurses who's joined the webinar, to actually give us a few snapshots of what's happening in KNH. Jemima Katama, you can unmute yourself and give us a snapshot of what's happening in Kenyatta National Hospital.
Jemima.
Jemima Katama? Okay, maybe she's having a challenge with her device. I think the other question is, how do you, I know you've talked about it for a few minutes, but and it's very good that the government is actually very proactive in terms of compensation for nurses. But do you run into like psychosocial aspects that the nurses taking care of these patients have, and how do you deal with that for the 600 nurses that you've reported, 600,000 nurses that you've reported that are actively working? So what's the modalities in terms of psychosocial support for them?
Okay, so the psychosocial issue is very important, especially the first wave of COVID-19 cases. So in our university and our hospital, we provide psychosocial counseling. If the frontliners have some stress or they have been experienced like discrimination, and then we will start to work with them. And then the other is many nurses, they worry about infected with COVID-19 and transmit COVID-19 to their family. So we provide dormitory for those people for nurses who at frontline. If they have any anxiety or any suspicion, might transmit virus to their family, they can choose to stay in the dormitory. Yeah, and in some, the other important thing is we decrease the patient and nurses ratio. So every nurses take care of 1 to 2 patients, including suspect patients, and they take turn, and they need to take rest. Yeah, so the psychosocial impact, we are closely monitoring and provide continuing counseling, and also provide material, and also provide like accommodation for them to reduce their anxiety and to fulfill their needs.
Thank you very much for that. And there's a question from Isabella Mbai. Has there been nurses who've actually, like for the 4 nurses who've been infected, have they taken the COVID-19 to their families, and has any of their family members been affected by COVID-19 based on the fact that they were operating or working with COVID-19 patients?
Okay, so for the 4 nurses infected with COVID-19, none of them transmit or have a hospital cluster or outbreak. No, not at all. and they don't because I mentioned they wear surgical masks, and some of them I interview with them and talk with them. They are very cautious because they know they walk at the front and they might have risk. So they purposely isolate themselves. So they protect their family very well. So none of them has been infected to other their family member. Oh, okay. So another question about in Taiwan, how many percent of patients are asymptomatic? In Taiwan, it's around 70%. Yeah, are asymptomatic. Yeah, 72%, I think.
Yeah.
Thank you very much for those responses. I think from this presentation, we're learning a lot of the things that we should adopt even here in Kenya. So some of the things that we've actually not been putting in place, and I it's impressive that the nursing staff there are not getting any infections. So that is really, really impressive. And I think those are things that we will adopt in terms of innovation, use of PPE, and lobbying to get support even from the government. So I think we're almost coming to the close of this session. I'll ask a question from Jacob Wanyama. In terms of how do you manage the nutritional care for patients who have COVID-19? So is there anything that you give them that boosts, that helps even with them their recovery?
Okay, so you mean the food security and the nutrition support for COVID-19? Excuse me? So your question about the food security and the nutrition support for patients with COVID-19?
Yes, that's the question.
Yeah, okay, so because you know in Taiwan, we really successfully against COVID-19. So we don't have many patients. So we don't have experienced this kind of situation. But according to there are many colleagues of mine working in New York. They really encounter some food security or poverty or malnutrition issue because the COVID-19 majorly hit the people with disadvantage. Like they have a labor, they have to work, so they have to work outside. And because economy depression, they cannot have a job, they cannot have sufficient money. So they really have problem to have food security, have nutrition problem. But mainly volunteers, they provide like the food bank and have provide free supplements and the nutrition to all community members. In Taiwan, actually, we don't have that situation. So I think based on others country, I try to answer that question. So try to link with NGO, with food bank, and also provide some free meal to those people living in poor community. Or they do, especially for street children and or homeless. They cannot have sufficient nutrition. Those support are very important, especially during COVID-19 pandemic.
Thank you very much. Maybe the final question that I'll ask is from Charles, in terms of the drugs that are used for COVID-19, are you using the trial drugs that are being advertised everywhere, like remdesivir? What drugs are being used to take care of the patients with COVID-19?
Okay, in Taiwan, we do join the trial for the remdesivir. Yeah, so we really have the injection drug for have a drug. So far is available and also effectiveness drug for the patient with COVID-19. And but because we mentioned 72% are symptomatic, less than 20% have a symptom and admit to hospital, and those patients will only provide like supportive treatment, and we don't have if they have pneumonia, especially if they have a viral pneumonia. Sometimes we just observe and give fluid and also give some oxygen, and that's it. Yeah, so we didn't provide additional help, but for the people in ICU, intensive care unit, or people who are critical symptoms, we do anything to help them, including remdesivir. Yeah, the drug has been proved effective, and also provide some other like steroid to provide help, something like that. And some of them really need ventilator, and they few of them using ECMO. They also survive. Yeah, in Taiwan.
Thank you very much for your presentation. It's been really, really insightful. And I think in Kenya, we need to do something better to help control the COVID-19 disease and the spike in cases. And I think this is something that all the attendees should actually take up. As you can see, the nurses in Taiwan are actually the ones doing the inventions and setting up the systems in place. I think the lesson that I've learned from this presentation is that it all begins with us. It all begins with us for us to be able to overcome this. Maybe to Professor Konayin, maybe your final comments even as we end the session.
Yeah, thank you. Asante sana. I really miss my friend in Kenyatta and in Kenya. And as I mentioned, I have been taught a lot about how to do research during COVID-19 pandemic, how to apply technology and innovation into to combating pandemic. Yeah, so if any possibility, I would like to share with all of you. Yeah, so thank you again, Asante.
Thank you very much, Professor Konayin, for that insightful presentation. We really, really appreciate. Thank you for all the attendees who've attended the session right now. The nursing experiences in Taiwan. I think we've been looking at the COVID-19 all wrong, in my opinion. And if Taiwan is actually doing it right, I think there are some things we need to borrow even as nurses, as healthcare professionals, and lobby for and innovate to be able to overcome this. For any queries about CPDs, kindly email us at knh@cpd@gmail.com. Otherwise, thank you very much. Good evening to the Professor Konai and good afternoon to all our attendees. Have a nice day.
Bye-bye.
先提关系去。
是关系是他们的比较没办法。
他说了，他说不要关，不要关。
Hello, bye-bye. It's nice to see you. Hi.
爸爸，你有你的啦，你有你的啊。